Hello, myself Dr. Sudeshna Mukherjee. I'm a consultant psychiatrist practicing in Siliguri. Today we'll be talking about some unusual OCD forms. So why it is important to discuss these unusual OCD symptoms? It is because I have seen that there is a lot of guilt associated with this unusual OCD, and many a times people get confused that if it is OCD or not. So generally whenever we talk about OCD, we talk about cleanliness symptoms and checking behaviors or maybe repeated counting behaviors. But beyond that, OCD can be, repetitive urges or repetitive mental imagery, which may be blasphemous or which you may not like it. They may be related to some sexual imagery. They may be related to some imagery you don't want to imagine about some religion, about God, or about people. Sometimes people do see sometimes nude images which they don't want to actually visualize or visit in their memories, but they keep on getting those intrusive imageries or intrusive kind of, blasphemous sort of pictures. So all these could also be form of OCD. Also, if somebody is having some kind of, abusive urges, maybe that person doesn't want to abuse, but the person feels that certain abusive urges are repeatedly coming. The person is feeling like abusing someone, even if he actually doesn't want to do it. That would again mean that this could be some form of OCD, because it is again an unwanted urge. So OCD is not just cleanliness, it is not just checking behavior or some repeated counting behavior. It has a lot of symptoms. A lot of symptoms can actually mean OCD, and it could mean some ritualistic behaviors also which you regularly do, and you feel like if you don't do it, there is some big mishap is going to happen, which we refer to as magical thinking. So if you have such kind of urges, or if you have such kind of thought processes which you understand that sometimes may not be logical, but they are repeatedly coming in your mind and they are forming a kind of anxiety or keeping you in a kind of confusion that you have to do it, otherwise something wrong is going to happen. So all these kind of symptoms could mean that you have some form of OCD. So do get it checked by your psychiatrist, and do understand, which I always keep on sharing with patients, that OCD is a disorder and you are a different person. Many a times, I have seen patients having that guilt that I am imagining sexual images, ma'am, I am imagining such things about God which I should not. So see, that is why there's a lot of stigma and there's a lot of guilt, and people don't want to come to the doctor. As I always tell you, that we as psychiatrists are always non-judgmental, and we see you separate from your disorder. So it is not you, it is your thought process, and there are proper treatments available for OCD, proper therapy available. So do visit your mental health professional, do visit your psychiatrist, and they will be able to help you with this. Thank you.